Hearing the words "you have cancer" usually feels like an immediate declaration of war. You picture emergency surgeries, intense radiation, and a desperate fight for survival. But what if I told you that for one specific type of cancer, doing absolutely nothing might be the best option? A massive study published in JAMA recently revealed a shocking medical trend. Nearly 60% of patients diagnosed with low-risk prostate cancer are actively choosing to skip treatment entirely. No surgery, no radiation, just waiting. And the most mind-blowing part? They are living just as long as those who rush into the operating room. Prostate cancer is the second most common cancer in men globally, according to the American Cancer Society. Yet, the medical consensus on how to treat it has completely flipped upside down in the last decade. Why are top doctors suddenly telling patients to just go home and relax? Are we giving up the fight, or have we finally outsmarted the disease? Today, we are diving deep into the fascinating science of active surveillance. We'll explore what exactly happens inside the prostate gland. We will uncover the hidden dangers of treating a disease too early. And we'll share science-backed lifestyle habits to keep your prostate healthy for life. To understand why we ignore certain cancers, we first need to meet the prostate. It's a tiny, walnut-sized gland located just below a man's bladder. Its main job is to produce the fluid that nourishes and transports sperm. Statistically, 1 in 8 men will be diagnosed with prostate cancer in their lifetime. That sounds terrifying, but here is the secret the statistics hide. Most prostate cancers are incredibly lazy. In the medical world, we call them indolent tumors. Imagine a cancer cell that is so slow, it basically sits on the couch eating snacks for 20 years. Doctors measure this laziness using a grading system called the Gleason score. A pathologist looks at the cells under a microscope and gives them a grade. A low Gleason score, like a 6, means the cells look almost completely normal and are barely growing. A high score means the cells are aggressive, angry, and ready to spread. For decades, the moment doctors saw any cancer cell, they brought out the big guns. But we eventually realized that a Gleason 6 tumor is like a sleeping snail. It poses almost zero threat to a man's life expectancy. In fact, autopsy studies show that many men die with prostate cancer in their old age, never knowing they had it. So, if the cancer is basically asleep, why not just remove it anyway to be safe? This brings us to the dark side of modern medicine, overtreatment. Using surgery or radiation to kill a lazy tumor is like using a bazooka to swat a mosquito. You'll definitely kill the mosquito, but you'll also destroy the house. The prostate is surrounded by a highly sensitive network of nerves and blood vessels. These nerves control two very important functions: urination and sexual performance. According to the National Institutes of Health, aggressive treatments carry heavy risks. A radical prostatectomy, or surgical removal of the gland, can lead to permanent urinary incontinence. It can also cause severe erectile dysfunction, drastically altering a man's quality of life. For a young man with aggressive cancer, these risks are absolutely worth taking to save his life. But for a 65-year-old man with a microscopic, slow-growing, lazy tumor, subjecting him to life-altering side effects for a disease that would never harm him is a medical tragedy. Doctors realized they were curing the cancer, but making the patient miserable in the process. We needed a new strategy. We needed a way to keep an eye on the snail without destroying the house. Enter the era of active surveillance. Let's be very clear. Active surveillance is not just ignoring the cancer. It is a highly structured, rigorous monitoring protocol recommended by the NCCN guidelines. Think of it like a detective constantly watching a suspect. If the suspect moves, we strike. Patients on this plan get regular PSA blood tests every 6 months to check for specific proteins. They undergo advanced MRI scans to map the prostate in high definition. And they have follow-up biopsies every 1 to 3 years to ensure the Gleason score hasn't changed. Take John, a 65-year-old patient. He was diagnosed with low-risk cancer 3 years ago. Instead of surgery, he chose active surveillance. Today, his quality of life is perfectly intact. But does this waiting game actually work? The science says absolutely yes. A landmark 15-year study published in the New England Journal of Medicine compared these exact approaches. They tracked thousands of men who had surgery, men who had radiation, and men who chose active monitoring. After 15 years, the prostate cancer survival rate for all 3 groups was nearly identical. The mortality difference was incredibly small, showing almost a 99% survival rate across the board. By choosing active surveillance, 60% of patients are avoiding unnecessary harm while staying completely safe. It is one of the greatest examples of less is more in modern medical history. So, if you are simply watching the prostate, what can you do to keep it healthy? It turns out, lifestyle plays a massive role in prostate health. Studies in the journal Prostate Cancer and Prostatic Diseases highlight a red superhero, lycopene. Found in cooked tomatoes and watermelon, high lycopene intake is linked to a 28% reduced risk. Cooking the tomatoes in a little olive oil actually helps your body absorb the lycopene better. Next is physical activity. Harvard researchers found that vigorous exercise reduces the risk by up to 30%. Exercise lowers inflammation and helps regulate hormones that can feed tumor growth. Warning: always consult your doctor before starting any intense new workout routine. The shift towards active surveillance is a triumph of modern science. We are no longer blindly fighting a word. We are fighting the specific biology of the disease. It teaches us that sometimes the bravest medical decision you can make is to wait. If you or a loved one is facing this diagnosis, ask your oncologist about your monitoring options. Knowledge is your best weapon, and a healthy lifestyle is your strongest shield. Stay informed, stay active, and take care of your body. This video is for educational purposes only. please consult a healthcare professional.